the cefuroxymes, they do the ciprofloxacins, they do the amoxicillins. When they don't get the results, it is here that they come. And when they come, they get the results. So one fascinating thing that I see about herbal medicine is how multifunctional they are. You see, they have multifunctional nature. Perfect. I remember when we were studying at Center for Plant Medicine Research. In the clinic there, we had close to an emergency case of a hyperglycemic person. And then our doctor taught us that we should give the person a half bottle of Levima. So the FBS before the Levima was recorded, and then 1 hour later, FBS after the Levima was also recorded, and there was a significant drop. So you could see that just one plant, researching into just that one plant, has given us an anti-malarial medicine, it has given us an anti-diabetic medicine, and it has also given us an anti-hepatitis B medicine. Doctors said I should take tarazacum, or doctors say I should take dandelion, but sometimes I have low blood pressure. That is when you can see that that dandelion you are taking is actually contraindicated to that your hypertension that you have.
Welcome to Herbal Alchemy, Edem.
Oh, thank you.
Yeah. So I've been hoping to meet you for some time now, and I think the opportunity just sprouted. So let's do this and let's hope to enlighten a lot of people about herbal medicine and all.
Yes, please.
Yeah. Okay, so can you first tell us a little bit about yourself and
okay,
your journey into herbal medicine and all?
Okay, all right. I am Dr. Ernest Edem, MH, medical herbalist, basically meaning I'm a doctor who treats with herbs. Yes, and then my journey into herbal medicine and clinical practice is somewhat interesting. We've always had a dream of joining or becoming doctors or nurses when we were asked when we were young. So my journey into the clinical practice has been a long-term dream, but into the herbal system or into the herbal space has been a little interesting because it really wasn't what I wanted to pursue at the university. But after I got rejected from the course that I chose, I took my time and then I researched. They gave me the option of herbal medicine, so I took my time, I researched into the program, and I saw that there are a lot of opportunities in there, and it's a new field. So if I should enter, it will be an interesting ride along, and then it has been. Yeah, so that is the brief explanation or the brief introduction.
Okay, so since you entered, what has been the most interesting thing, or what aspect of herbal medicine do you find interesting?
Well, herbal medicine, it's broad. Plants are innumerable, you understand? So one fascinating thing that I see about herbal medicine is how multifunctional they are. You see, they have multifunctional nature. If I say a multifunctional nature, it means one plant can be used to treat or to manage a lot of diseases. People ask why. When you take a plant part or when you take a whole plant and then you do some research into it, you see that there are some active ingredients that are used for, let's say, treating malaria. You go on and then you see that there are ingredients that can be used to treat typhoid. You go on and you see that there are some ingredients, minor or micro ingredients, that can help with diabetes. So when you take plants, the thing that fascinates me the most about herbal medicine is that because of its innumerability in nature and then because of its multifunctionality, it can be used to treat a host of diseases. So it looks like we have a bulk on our hands to work with. That is fascinating to me about herbal medicine and then plants.
Okay, so if I get you right, there actually should be, or there is a lot of research into herbal medicine then, which brings up to speed with all these things that you are talking about.
Yes, please, exactly.
So can you enlighten us about some of the interesting research that you know of in herbal medicine?
Okay, all right. when it comes to research, there have been a lot of researches that have gone on, and then some are still ongoing as we speak. And then we know that in future, that particular research aspect is going to explode. The kind of research that actually we are speaking about is not something that is just pick one or two papers, combine words, and then bring up results. Research actually contains or entails a lot. You have to get a plant, you have to run it through a lab to get whatever that the plant contains. After that, you have to run it through a lab to see its toxicity level. After, you have to run it through a lab to see what it can treat. So when we talk about research, it's a lot. One research that I really found interesting was the research into a plant called Nibima by Center for Plant Medicine Research at Ikuape Mampong in Ghana here. Nibima, we all know, have been used to treating or have been used to treat malaria for a long standing while. Recently, the research into the plant again, and then it is able to do wonders with hepatitis B. We gave that particular, just a decoction of that particular plant to a hepatitis B client, and then over a course of some period, after taking it consistently, the viral load significantly dropped to undetectable values. You understand? So just the plant Nibima has anti-malarial effects, has anti or anti-hepatitis B effects, and then also has anti-diabetic effects. I remember when we were studying at Center for Plant Medicine Research, in the clinic there, we had close to an emergency case of a hyperglycemic person, and then our doctor taught us that we should give the person a half bottle of Nibima. So the FBS before the Nibima was recorded, and then 1 hour later, FBS after the Nibima was also recorded, and there was a significant drop. So you could see that just one plant, researching into just that one plant, has given us an anti-malarial medicine, it has given us an anti-diabetic medicine, and it has also given us an anti-hepatitis B medicine. So research is actually very good. So if we should go on to increase the research base into a lot of plants, we are going to get a lot of medicine out of them.
Yeah. So I think I've been debating a lot about this topic with a lot of people. And
Okay.
I think this also brings us to the fact that herbal medicines actually are not supposed to naturally bring about just one effect. You realize I've been talking about it on my channel too.
Yes.
It's not naturally supposed to bring just one effect.
Exactly.
Taking example, let's say when we are taking orange.
Yeah.
Orange has roughage, which helps easy bowel movement. It has vitamin C, preventing scurvy. Has a lot of vitamins which boost up the immune system and then
Yeah.
helps diseases and all. It's the this oily thing in the covering of the orange,
Yeah.
in
The
the fruit.
volatile oil. Yeah.
The volatile oil, yeah, it's also good for the skin and all, and also it repels mosquitoes and all. So when you talk about herbal medicine, actually having to cause having a lot of effect, they don't understand. And I think this is what the traditional or other herbal medicine people used to sell their products, and
Yeah.
they they,
Yeah.
they tend to
It's
make a lot of.
it's a whole package. When you take one herb like this, let's say if you are taking the plant of let's say Lupia multiflora like this, it is an antihypertensive. You understand? It's also
Yeah.
a diuretic or a diuretic, which I mean in the long term also brings about antihypertensive effect. So when you take plant parts have a lot of uses. If you take mango, you can get something you use the leaves for. You can get something you use the fruit for. You can get something you use the stem back for. You can also get something you use the roots for. So when you take the whole plant, say yeah, when you take the leaf, when you take the stem, when you take the roots, and then you combine it, it's going to be able to treat a host of diseases. So that particular point is justified.
Yeah, and concerning we medical herbalists doing a lot of research,
Yeah.
other than the other people, other scientists and co doing research, do you think patients should also start reading about herbal medicine, they should also start. Do you think they should also start doing research on their own? Because I've been also talking about this, and they think it seems so abstract, like it seems so far off. But I've been advising people that it's important that when your doctor says go take Vernonia amygdalina, that is bitter leaf, you should also, though you are taking it, you should also at least try and read something about it. Okay, this herb is good for this, so that you don't just get up and be like, when I had headache, my doctor told me to take bitter leaves or something, and then now everybody is supposed to take bitter leaf, bitter leaf. Maybe your doctor
Yeah,
even forgot bitter leaf is not good for you with
yeah,
a particular disease or a particular infirmity. You get it, and then you took it, but now you need it for something else. But maybe in that situation it was dire, so you had to take it. But then the doctor didn't advise you, or he forgot. But you reading, you get to know that, oh, okay, I have ulcer, I have this, so this plant actually is not good for me, so I should not overdose it or something like that. What do you think about that too?
Well, it helps for patients to be informed about the medicine that they are being given or the medicine that they are taking. You have to know the particular medicine that you're taking and then what it does for your body. You have that right as a patient. You understand? Number one, what it does to you is that if you read about it and then, or if you research about it and then you see that, oh, okay, this is my condition, and it's true that when the doctor told me to take a mixture, this mixture contains Vernonia amygdalina, and then let's say Vernonia amygdalina is an antidiabetic. So my sugar was high. That's how come the doctor told me to take this particular plant so that my sugar will come down. And then when you read more about it, and then you see that okay, let's say the doctor told me to be taking a lot of dandelion, Parazacum officinale. Yes. But you didn't tell the doctor that sometimes you have hypotension or your pressure is usually sometimes on the low. You know that Parazacum officinale also acts as a diuretic in a way when you take it very plenty. So when you read it and you see that doctor said I should take Parazacum or doctor said I should take dandelion, but sometimes I have low blood pressure, that is when you can see that that dandelion you are taking is actually contraindicated to that your hypotension that you have. So then you
Yeah,
can go back to the doctor and say that, oh, I'm sorry, I didn't tell you sometimes my pressure drops to lower value. So I read about this tarazacum or I read about this dandelion and I saw that it can further reduce my pressure, which is dangerous. So when patients are told to do research into medicines that they are given to, it actually helps. So as for that point, that part that you have taken to tell patients to research into their medicine, I actually support it.
yeah. And then also, I think you've been mentioning a lot of stuff, diuretic, anti-diabetic, and all and all.
Um,
You know, we do a lot of clinical training, a
yeah,
lot of clinical stuff, and people
yeah,
don't know much that we do a lot of clinical stuff. They think we only do herbs.
yeah.
Can you throw more light on how we do our clinical on the side and then integrate our knowledge of herbal medicine and then add to the herbal knowledge to
Okay,
treat?
okay. That's a long journey. So I'll start from campus, then we will move on. So we are medical herbalists. We are trained medical practitioners who treat with herbs or with plant products. You understand? Before you become a medical herbalist, you have to go through a certain teaching or a certain training. And then part of this training is clinicals. When we talk about clinicals, clinicals is attending the hospital or attending the clinic, getting hands-on practice with cases that are available and then how it is treated or managed in the hospitals. So right from level 100, after you finish the theories, after you read a lot of the theories, right in level 300, you are exposed to these clinicals. You start going to the clinic. Then you have a supervisor who will be teaching you, okay, this case, this is how we do it in the Orthodox. We use this medicine. We use that medicine. So level 300, you do it on vacations. Even in school, it's a course, 6 credit hours. Level 200, sorry, level 300, you do it. Level 400, you do it. After that, you go and do national service. And then national service is divided into three parts when you read herbal medicine. You can choose to be in a research institute like Center for Plant Medicine Research or even Noguchi. You can choose to be in the clinical setting that is in a hospital, and then you can also choose to be the TA or in the educative aspect as well, the teaching assistant. So those who choose to be in the clinical areas or in the hospitals, their clinicals continue. They meet cases, they meet simple cases, and they meet difficult cases. So before you finish your national service, the 1 year national service, when you are in the hospital, you have a lot of hands-on practice in the clinicals. After that, you are not done. There is another 1 year that you have to go and do at Equiapim Mampong. 6 months at Center for Plant Medicine Research, and also 6 months at the Tepashi Memorial Hospital. In the Research Institute, that is the Center for Plant Medicine Research, you have about 6 weeks that you be in the consulting room and also learn with the doctors on how the herbs are used to manage the cases. After that, when you go to the Tepashi Memorial Hospital, as for that place, it is limitless. You will be in the emergency room, you'll be in the wards, you'll be in the obs and gynae departments, you'll be everywhere. So when we talk about clinicals, medical herbalists are doctors. They know what they do. They have that clinical knowledge. So it's not as if they will just tell you to go and take bitter leaf just because they know that bitter leaf is anti-diabetic or they know that bitter leaf is this. They know what bitter leaf does to your body. And they know that if you are taking metformin and then you add this particular herb, it is good or it is not good. That is how come they say that when you are taking herbal medicines, you should consult a herbal or a medical herbalist to know that this medicine that I am taking, can I combine it with this herbal medicine before you go on? If not, you are just trying to play with your life. Exactly. So as for clinicals, we are good with clinicals because we actually have the training.
Yeah. I get you. There's a whole lot of clinicals that we do. It's not just herbal medicine, herbal knowledge. Yeah.
Yes.
Yeah, for that one you are right. Okay, so can you, I think you are still actively practicing, right?
Yes, please. Yes, please.
Yeah. I intentionally asked that because I wanted you to dive more into the kind of diseases you've been treating, the kind of diseases you've been seeing that you would recommend herbal medicine for. That's why I intentionally asked you that.
Oh, okay.
But though I know about that, can you mention some of the diseases you treat so that it doesn't seem so odd? It doesn't seem so far off when you tell people that I can treat this or this can be treated. Can be dealt with, or there is a solution for this.
Okay.
Yeah.
All right. I mean, I am actively practicing right now. And then you tend to meet a lot of cases, you understand? Yeah. And then we are trained or we are taught to refer cases that are not herbal medicine cases. So cases that I don't touch are surgical cases, obs and gynae cases, and then also pediatric cases. So meaning cases that are surgical or that has to be solved in a surgery way, cases about pregnant women, and then also cases about children, especially under 12 years going. You understand? So apart from that, every other case that I meet, herbal medicine is able to do something about the case. Let me mention a lot of, right from the most common to the ones that are not so common. So malaria, typhoid, stomach ulcer, diabetes, hypertension, what we call peripheral neuropathy, the ones that they will be having tingling sensations in their legs and in their feet or in their hands as well. And then asthma. It would be surprising that somebody will hear that we attempt treating asthma with herbal medicine, but we get excellent results. Yes, we also treat infertility. As for infertility, it is very, 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 very positive, and then we have extremely good results with infertility. Low sperm counts for the men, sexual weakness for the men, irregular menstrual problems for the women, skin diseases or skin infections, sexually transmitted infections. As for that one, a lot of people, they do the orthodox medicines, they do the cephaloxames, they do the ciprofloxacins, they do the amoxicillins. When they don't get the results, it is here that they come, and when they come, they get the results here. So as for the host of diseases, plenty, even sickle cell disease, we are able to manage to a certain point so that the frequency of the crisis come down a lot.
Okay. Dr. Edem, are you on social media?
Yes, please, I'm on social media.
Also, can you also tell us a little bit about how you have used social media to influence a lot of people about herbal medicine?
Okay. Right now in this era, if you want to get something or if you want to get a message to people, social media is one of the swiftest places that you can pass it through. So on my social media, what I do or what we do is that we blog about or I write herbal medicines, misconceptions in herbal medicines, or sometimes I take one particular plant and then dive into it and then write about it and then put it on our social media pages so that people can read about it. So that if they are taking a product from that particular plant, they will know that it is not poison. It is actually good for whatever that they are taking it for. But we always tell them to exercise discretion. We can't self-medicate. The fact that we are giving information about herbal medicine doesn't mean that it's just go pick them up and then be boiling and be drinking. It is extremely not safe. So we deploy social media on dissipating the messages about herbal medicines to people in Ghana, in Africa, and across the world.
Okay, so Dr. Edem, do you have any entrepreneurial pursuits or it's just herbal medicine and clinical medicine? Herbal medicine. Do you do any other things?
Yeah, actually, I have an entrepreneurial pursuit that I'm involved in. You understand? I actually have, or I'm part of the founders of a startup called Rafamol. Rafamol, we are all over the place when it comes to herbal medicine programs and then educating people about herbal medicine. So Rafamol is a health and wellness hub that we came out with. And then our website is www.rafamol.com www.rafamol.com. We do three things. The first thing is that we educate the public about herbal medicine and current health issues at hand via writing or via our news blog, which is Rafa News. That is number one. The second is that we have a health and wellness marketplace where all herbal medicines, registered herbal medicines approved by Food and Drugs Authority in Ghana here are enlisted and can be purchased through the site. So if anybody is looking for any herbal medicine at all in Ghana here and beyond, we have them on our platform. And then we don't just enlist any herbal medicine onto our platform. We enlist certified products by the Food and Drugs Authority onto our platform. So we are giving you safety when it comes to herbal medicine. That is number two. And then number three is that we have an online consulting platform where clients can come and meet their doctors online, complain about their diseases, their symptoms, and then consultation is done online and prescription is given to them. So this is basically what we do at rafamol.com. And then our vision is to make every African making health and wellness a habit. That is our vision statement. Every African making health and wellness a habit. We want you to be healthy. We want you to stay fit. We want you to come out of your disease and come onto the healthy state that you were. But we want you to do it the natural way. That's how come our tagline is live your life. When you see live your life, live is a part of a plant. And then that part, exactly, the leaf represents we trying to tell you that you should actually get involved with nature more. So that is basically what Rafamol does.
I wanted to also ask you this question. How do you see herbal medicines in terms of complementing Orthodox medicine?
Okay.
What do you think about herbal medicine being available to complement Orthodox medicine, or Orthodox medicine being available to complement herbal medicine?
Okay. In any of the ways, whether herbal complementing Orthodox medicine or Orthodox medicine complementing herbal medicine, I think it's an excellent idea because when it comes to health, our main goal is to get the client or the patient whole again. If you have a client and then someone comes to sit in front of you and say that, okay, Nowadays, I'm not feeling this. I'm not feeling fine. I'm feeling this pain here. I'm feeling feverish here. I'm feeling this a symptom here and there. All that we want as physicians is that the person should be made whole. Now, achieving that, you have to employ anything that is not harmful to the person to make the person whole. So when it comes to herbal medicine complementing orthodox medicines or orthodox medicine complementing herbal medicines, it is an excellent idea that we all have to accept. There have been situations where people come and sit in front of me. I give them herbal medicines. They seem to do well, and then later they will come that the symptoms are back. But I know drugs in orthodox medicines. I just have to add it and then teach the person how to take it over time. When you are taking herbal and then orthodox, you don't have to take it at the same time. Because we are trained in such stuff, we know what we call drug-drug interaction. So when I am using orthodox drug to complement a herbal medicine, or I'm using a herbal medicine to complement an orthodox drug, usually I tell the client to space the taking of these two drugs at least by 1 hour or by 2 hours. You understand? When it comes to using an orthodox drug to complement a herbal medicine drug, it has been done countless times. That is how come right now the government or Ghana Health Service is trying to incorporate herbal medicine into most of the hospitals and clinics in Ghana here because some things don't work well with the herbal medicine. They work well with orthodox medicine. Some things don't work well with orthodox medicine. They work well with the herbal medicine. So there can be a collaboration to complement the two of them so that the goal for all of us that the client should be whole can be achieved.
Okay. So talking about that, this
Yeah.
brings my mind to something. What do
Uh,
you think is the level of acceptance of herbal medicine in the medical community?
this issue. Well, so as it stands, the level of acceptance is very minimal among the medical environment or society. When it comes to herbal medicine, when they ask you and you said, "Oh, you're a medical herbalist," they don't know what that is. Yes, a lot of them don't know what that is. They thought that the government or KNUT have just recruited some people from the villages who practice herbal medicine and have brought them onto the field. They don't know what that is. So the acceptance is low. It is not their fault. But some people know what that is, and yet still they don't want to accept us because they've not seen us do what we can do. And those of them that have seen us do what we can do, they now know that okay, we are just not some uneducated people that are also brought that have been brought onto the field. We actually know what we are doing. So generally, the acceptance is low, but it can be corrected. It can be corrected via education. It can be corrected via us proving ourselves to the people. It can be corrected via this social media that we spoke about. We are a people. Ghana Association of Medical Herbalists are a people who are trained as doctors, but actually use herbs to treat, manage, or prevent diseases. So if we are able to get out there as ourselves and then market ourselves well, also show them what we can do, they can actually accept us to the level where we actually need to be accepted. But but as it stands, the acceptance level is really, really low. And that is making a lot of us struggle in some of the institutions because you really have to prove yourself before they know that, okay, now we can accept you to the level that we want you to see.
Yeah, regarding that, I think some few days ago I went to the bank and the occupation side, you see, they usually provide the professional, and I wrote about medical herbalist there, and the banker just looked at it and said, then or then they give themselves names. Then or then
Oh,
they give
really?
themselves names.
Come on, that's so bad.
and
So,
and I
so,
looked there
so
and I
uh,
was like, have you not seen or heard of a medical herbalist before? He said, no. And I said, when was the last time you visited an actual hospital where they incorporate both herbal and
and okay.
orthodox medicine? And she was like, nah, I don't remember. He said, nah, that's why. But if you are very up to date with things, you would realize that a lot of people are now into herbal medicines, and we have medical herbalists actually in hospitals, aside having herbal clinics around occupied by traditional and herbalists or medical herbalists. But so how do you stay updated with latest trends in herbal medicine and all, or you use Rafamo? Do people have to depend on Rafamo, or let's say I want to stay up to date on latest trends?
Hello.
What do you think about that? Is that one of what Rafamol is doing to help people stay up to date with latest trends in herbal medicine? Or do you actually have a specific go-to area or go-to source where you used to train yourself on that?
Okay, when it comes to latest trends in herbal medicine, I, as a clinician, you see, before you will be updated with a lot of new drugs or new plants that are used to make products for people to consume, you have to read. So I, as a medical herbalist, we usually have our sources where we go and then we fish out researches that have been done recently and previously, and then we read. And then we also have some of our friends in the academia where they are already doing some researching activities or research projects, and they write papers and they make it available to us to also what to read. You understand? So when it comes to the consulting room, to stay abreast with the plans, new plans or new products that are coming out or their activities for you to be able to use in your practice, we read from the academic sources, those online, and then those that we have access to in avenue or by avenue of our friends. And when it comes to trends, that is where Rafa More wants to come in. We usually make known these trends to the public by using the platform Rafa More, by writing, by animated videos, by interviews, by a lot of things. You understand? So when it comes to trends, we try to do our best by putting it out there. But when it comes to researching or getting abreast with new products or new plants that have been researched on to get the activity so that you can incorporate into your treatment, we actually read from some sources that we know.
Okay. So we are getting to the end of this, and I want to just pick your mind on some few things, and then we're up and running. Okay, so what do you think about drug abuse and the use of herbal medicine, the haphazard use of herbal medicine, especially when people think herbal medicine is natural and safe? So everybody is self-medicating nowadays. So what do you think? What do you think about this? Can you throw some light on it for us?
Yeah. This self-medication issue is a big problem on our hands because, all right. So when it comes to self-medication in herbal medicine, because they will hear somebody say that, oh, as for this medicine, when you boil it and drink it, it will treat your malaria. As for this medicine, when you boil it and you drink it, it will treat your typhoid fever. So they tend to abuse or self-medicate themselves. But that is not advisable. It is ill-advised because you actually don't know a lot into these plants that we are talking about because you only thrive on hearsays. You hear from a friend, you hear from the TV, you hear from the radio or something. Then you go and boil. What if what you are boiling is actually not what is going to help your sickness or your disease? What if what you are boiling is actually contraindicated to a certain disease that you have? That you yourself, you don't know that the drug you are taking will go and complicate things for you. So as for self-medication, we don't advise it at all because it's like you are trying to play a bet or you are trying to rely on a probability. The probability that this plant can treat malaria doesn't mean that when you boil it, it will treat your malaria and then leave you as it is. You will have to always get your source, or you have to always get your medicines, or you have to always get your information from medical herbalists, trained medical herbalists. They know a lot into these plants. They know what plant to combine and what plant not to combine. They know that if you are taking this medicine, this orthodox medicine, it is not advisable to take this herbal medicine. They know that if you take this herbal medicine in this dose, it is harmful to your body. That if you take this herbal medicine in whatever dose, it won't do anything to your body. So when it comes to self-medicating, we always hammer on it that it is not something that should be advised at all. So example of what we are speaking about, or example of the self-medication, herbal medicines that we are speaking about, is something as simple as garlic, what garlic can do to you. People have warfarin as one of their drugs that they take, and then warfarin is a blood thinner or it's an anticoagulant. When we say an anticoagulant, it means it thins the blood for the blood to be able to flow well in the blood vessels. Garlic also does the same thing. So if you are taking warfarin and then you go and add garlic to your herbal medicines or to your drugs that you are taking, it means it will have too much of a potent effect that if something small should cut you, you would really bleed because it will take time before there will be blood clotting to stop the bleeding. Not advised. If something as simple as garlic like it can do something like this to you, it means you shouldn't joke with self-medicating with herbs. Something as simple as ginger. Ginger has the same effect as garlic. It's also a blood thinner. We use it to cook. We use garlic and then ginger to cook. So when you are taking blood thinners and then you increase these particular ingredients in your food preparation or you take them raw, it means you are contraindicating yourself.
Yeah, okay. I think one reason why I also started teaching the herbal medicine stuff and generally health stuff was our our trip. I don't know if you remember, we went for a health screening, Rafa Mall and Perpetual Aid Foundation at Suhun. I don't know if you remember.
Yeah.
Yeah,
I
yeah,
remember.
yeah,
I
yeah.
really.
I realized that diseases or infirmities as simple as malaria, diarrhea, hypertension, the people did really not know. They didn't know what these diseases meant. They didn't even know what malaria was. And I was like, nah, we have a lot of work to do. Those of
Yeah.
us who really understand the thing, we are the ones in the cities. And if nothing at all, we have our phones and technology around us. So it's easy to get information. But for these people, they have no idea about it. So how do you tend to engage the local community to promote awareness? Or most of what you do is around Rafomo?
Yeah, so promoting awareness of um, diseases and also educating people about herbal medicine and diseases as a whole, just like you stated, when you go to the villages, they have heard about malaria, but they don't really know the nitty-gritties of malaria. They don't know how to prevent it. They don't know what to do when they have malaria. They just tend to boil things and drink. They've heard about hypertension, diabetes. They don't know what brings about hypertension. They don't know what brings about diabetes. They don't know what to do when they have symptoms, some symptoms, and actually it is pointing to diabetes or hypertension. They are very clueless about diseases and are also very clueless about some herbal medicines. So what we intend to do is that we actually usually embark on outreaches. Sometimes we go into schools in the rural areas. We go into churches in the rural areas. We tend to educate them about such things, about simple diseases or most common diseases that we think might affect them because of their living conditions. Number one, malaria. Number two, typhoid fever because of how the environment is and all that. Number three, hypertension because of lack of exercise and because of their eating habits, diabetes, a lot of things. So we do outreaches, and then inside these outreaches, we organize screenings so that even as we educate people on them, they also tend to do free screenings for them so that we can pick up those of them or some of them that have already contacted those diseases that we are talking about, educate them on it, and also try to prescribe some drugs for them to go and get. Or if it is anything serious, we direct them to the nearest health center for them to be taken care of. So apart from educating people on social media, as we said, that one is for the city people because those are the people who have access to internet and also electricity. Yes. But so
Yeah,
for the
yeah.
rural people, we have to invade their place. We have to go into their spaces and then talk to them one on one in churches and in schools, and then help them with screenings and then disseminate whatever information that we think they will need. So that's how we do. or that's what we do.
Where do you see the future of herbal medicine? That's where do you see it headed, especially in terms of research and acceptance in the mainstream healthcare? And also, now that we have everything is AI technology and then the digital economy, now where do you see herbal medicine in some years to come?
Okay, herbal medicine in some years to come, I think it's going to be explosive. It's going to be one of the main things talked about, especially when it comes to research. You know, because of the side effects of most of the orthodox drugs, the usage of orthodox drugs among some people now are not so encouraged, or they feel scared using orthodox drugs. Now, a lot of people are reverting back to herbal medicine because of its safety. Now, a lot of research is ongoing on going on into herbal medicine because we want to develop products to be able to compete the number and the efficacy of orthodox medicines that we have in the market. Because a lot of people want to run away from the orthodox medicine. It's not as if they are not effective. They are very effective, but they tend to have a lot of side effects that people don't want. That is how come there are lots of products that is bringing up to be food supplements. Food supplements are basically herbal medicines because they are gotten from food or plants. So that is the future of herbal medicine. The research is going to explode. There are a lot of things going on to bring about new products that will compete with these orthodox products and also complement them. You see, just like we stated earlier, or we talked about earlier, you may be treating a disease with an orthodox medicine, but when you go and add a herbal medicine, it's going to potentiate its effect. You may be treating a medicine with herbal medicine, but when you add an orthodox medicine, is going to potentiate its effect. So the research future for herbal medicine is big. It is going to be more than 4 or 5 times of what we are seeing now. In the next 10, 20 years, herbal medicines will be all over. Look at China. Everything they do most of the time is herbal medicine. Look at Japan, look at India, and look at South Korea and North Korea. Most of their medicines that they use to treat their people are herbal medicines. And these are the places that have the big schools that teaches into herbal medicines really well. Look at UK and then look at Canada itself. They are all trying to incorporate this food supplement thing into their system. Now, these food supplements are basically herbal medicine. That is the future of herbal medicines when it comes to research. When it comes to the technology side, herbal medicine has to play. You see, just like Rafa More right now, we are leveraging on technology to make herbal medicine available to the world, to make the knowledge of herbal medicine and also the products of herbal medicine available to the world. So when it comes to technology, when it comes to the future of herbal medicine, especially when it comes to research, now when you come to the research, because of this particular state that we are in, a lot of people are trying to produce these food supplements. Before you can produce a food supplement, you have to really research into the plants that you want to use and then what you want to make the plant to do, if it can actually do it before it can be patented and become a sellable food supplement. Therefore, when it comes to herbal medicine, the future of herbal medicine, it is very big. We are not saying that it is a competition for orthodox medicines. It is just a complementary medicine to the efforts of bringing health to whoever that is not feeling well or bringing health to the whole planet as a whole. The future of herbal medicine when it comes to technology is also exciting because as we started in Rafa More, we are leveraging on ICT, or we are leveraging on technology to bring herbal medicines to everybody or to the world as a whole, both the information and both the formulated products and also raw materials. People actually want raw materials to formulate a certain medicine. Maybe they are in Canada, they need some African raw materials to formulate medicines. They can't fly to Africa just to come and get the raw materials and then go back. That is why Rafa Mall is leveraging on the technology to make sure that they can reach us here in Ghana, in Africa, that we get them any raw material at all, we ship to them, and then they produce whatever food supplement they want to produce. This is the future of herbal medicine, both in research and also in technology.
Oh, okay. So to get you right, I think you highlighted on the aspect of herbal medicine now being brought even into the area of food, a lot of food supplements now, and then the leveraging of technology for people elsewhere to reach or to be able to access herbal medicine wherever they find themselves. Yeah,
Exactly.
okay. And I think with regards to that, I see that you also dabble a lot in terms of using Miracell. I think your Miracell product. Can you
Oh, okay.
talk about Miracell? Can you throw more
Yeah.
light on Miracell so that people get to know about it?
Okay. So Miracell Plus is a product that I came across somewhere 2 years ago. It is actually a stem cell technology product. When we talk about stem cell technology product, it is a product that is designed to increase the stem cells of your own body. Because stem cells, or because this Miracell is able to increase the production of stem cells in your body, it is able to identify sick cells in your body, dead cells in your body, weak cells in your body, and then energize them by themselves to reform and become new. Because of this small process that I've mentioned here, it is able to reverse a lot of both acute and then chronic diseases. Stem cells are the future of medicine. The most difficult diseases that we've not been able to treat, stem cells are actually trying to redefine that status quo because it is able to gradually reverse every infirmity or every disease back to its original state. When we talk about liver problems, kidney problems, when we talk about bone problems, nerve problems, stomach problems, vision problems, auditory problems, dental problems, everything, because it is a stem cell, it is able to gradually reform the body to its optimum health.
Okay, so let me get you right.
Yeah.
Stem cell is not herbal medicine, right?
Stem cell is herbal medicine.
Can you throw more light on that? How stem cell
Okay.
is herbal medicine?
So it comes in two parts. There are actual stem cells that the advancement of medicine would be able to move from one person into another person because the person lacks some amount of stem cells to help regenerate the person to his or her optimal health. But Miracell is a stem cell product that have been formulated from nature, most of them from plants. So the ingredients are a lot of plants: goji berry, apple stem cell. We have salmon peptide, salmon ovate peptide. We have ashwagandha. We have a lot. So they have formulated it from plants and then natural sources. But when it enters your body, it increases the production of the stem cell of your own body to its optimum so that it can reverse every chronic or acute disease that you are battling with. So that is Miracell Plus for you.
Okay. So in case somebody wants to get Miracell or somebody is looking for these stem cell products, right now I think we are talking about Miracell more. How do they get Miracell, or how do they contact you?
Oh,
And
okay.
then after that, you can leave your social media handles or anything. If somebody wants to get in contact with you and they like to talk more about herbal medicine or stem cell products.
All
Yeah.
right. So when it comes to where you can get Miracell Plus or the stem cell products that I'm talking about, you can open www.rafamall.com always, and then search for Miracell Plus. It will just pop up and then you make your order.
Okay, so I'm guessing Miracell has been doing a lot for your patients then. So just in case somebody wants to get Miracell or want to talk to you more about Miracell, you can then add your socials so that we wrap it up.
Contact me via my social media pages. On Twitter, you see Dr. Ernest Edem on Twitter. On Facebook, it's Ernest Edem. On Instagram, it's Ernest Edem. Yes, so you can contact me anywhere and then we can get you your Miracell Plus or any other products that you want. Alternatively, too, you can call me on 0559 525345 or 050 154 1511 to get us talking.
Okay, Dr. Edem, thank you for doing this with us. Can you give us your final words? Any
Yes,
final
so
words?
all right. My final words is to clarify a misconception on the market or out there in the public about herbal medicine. Herbal medicines, usually people say will cause kidney failures and then liver failures when you take herbal medicine. Herbal medicine is a medicine, so definitely when you abuse it, it can cause some organ failures. But the therapeutic index of herbal medicine is so large that before you can get organ failures from herbal medicines, it's either you've taken a poisonous herb or you've really, really abused the herbal medicine for a very long time before you can actually get kidney failures or liver failures or organ failures from herbal medicine. So herbal medicine is safe for all. But before you get any herbal medicine into your system, it should be prescribed by a medical herbalist or someone with knowledge into herbal medicine. Thank you.
Okay. Thank you for doing this with us, Dr. Edem.
You are welcome, Dr. Prince.
Hopefully would get you back again on the channel.
Yes, please.
Yeah, and I'm sure you've enlightened us a lot. This few is it some few minutes?
A few minutes. Yeah.
Okay. But thank you for doing this with us.